What happens if the level of predictability that is standard in a doctor's office changes? How does a doctor respond to that? What happens when the world shifts? What happens when the theoretical becomes the new normal? What does a doctor do? How does a doctor respond? Today on the Chadcasters, we interview Dr. Christine White and explore how this pediatrician was forced to look deep inside and make decisions that radically changed her life, and how she chooses to care for her patients now.
A doctor and a musician walk into a bar and start talking about frequency, tone, life, and the abundance of it all. And with an explosion of collective thought, the Chadcasters are born.
How you doing, Chad?
I'm good. How are you?
Man, I'm rocking it out. It's a beautiful day. So today on the Chadcasters, we have a very special guest. She has been in practice about 25 years. She's a pediatrician. She's well acclaimed, and she is one of the most, I would say, notable pediatricians in the Kansas City area. And we'd like to welcome Dr. Christine White.
Hello. Nice to be here.
It's wonderful to have you. So, you and I have gotten to know each other over the past, I would say, about 2 years, a bit around that time frame.
Well, we got to know each other in the spring/summer of 21 when I was running for school board.
Oh, wow. It's been that long.
Yeah, COVID time, when we were working on some stuff with kids and getting them in school and masks and stuff like that.
Okay. You kind of just jumped right into the deep
Yeah,
end.
well,
Let's do this.
Let's yeah. 2021 was a peculiar year, and everybody listening to this is going to be familiar with it because it's still appropriate in our timing. But 30 years when somebody goes to listen to this, they may have been 1 year old when they heard, Yeah. So let's talk about what shifted. What was the change that happened let's say we look at March 2020 compared to March 2021, that compressed time period. In your experience, what changed?
So in March of 2020, the pandemic was declared, and we were told we'd have 2 weeks to flatten the curve. And when that extended to 6 weeks and then 2 months and then who knows how long, I started to see kids with significant mental health issues, depression and anxiety that was very difficult to treat. And that's because we were forcing them to live in a way that humans aren't supposed to live. They were stuck at home. They could not see their friends or family. They couldn't exercise. Some couldn't go outside. They were scared. They were watching endless news cycles of doom and gloom. And so it's not unusual that humans would be depressed or anxious. When the discussions were just starting about will we let kids be in school in the fall of 21, I started to get very nervous about that because I knew they had to be in school. And so I started going to each of the school board meetings at Blue Valley and just really discussing what I had seen as a physician and advocating for kids to be in school. It had been done in Europe and certain countries, and it was being done safely, and it needed to be done here. So I spoke at every school board meeting from August till February about getting kids in school, and they were then allowed to start to go back, not because of me, but a lot of people were speaking out. And then after that hurdle was done, I started speaking about choice in having to wear a mask for the 2021-22 school year, because masks were still the norm. And I just wanted people to have a choice for that coming school year, 21-22, to decide if you wanted your kid to wear a mask to school.
So you bring up a few things that really aren't talked a lot about anymore. When they said they wanted to flatten the curve, what curve were they referring to?
I think that they were expecting a huge number of cases right off the bat of COVID and it would overwhelm our hospital capacity. And they wanted to maybe allow the cases to come more gradually so that we could deal with the sick, get them out of the hospital, get the next group in. So that, I think, was the curve they were talking about.
Okay. Now, when it comes to children, we're going to be referencing 18 and under? Is that what you want to go with on
Sure.
children?
Yeah.
Okay. What was the risk for a child during that time to contract COVID in a way that would cause major deleterious health impact?
So children can contract COVID like any other human, but children who are otherwise healthy, meaning they don't have a cancer or something that affects their immune system significantly, or they don't have any significant medical comorbidities, the vast majority of children are going to do extremely well with COVID. Some of them, they have asymptomatic infections. Many of them do. A large percentage have very mild cold symptoms. 2 or 3 days, the parents are like, wow, that was COVID for my child. And then there's definitely a decent percent that have what would seem like an influenza, where you have 3 to 5 days of fever, cough, headache, sore throat, body aches, and you feel pretty cruddy for 4 or 5 days, but you recover very well and for the most part have no long-lasting effects.
Okay.
So what about the argument then that they could bring it home to the house and the family? How did you deal with that?
Well, I think with any virus, anybody can bring the disease to anyone. So there's some people that argue that kids are less infectious. I don't know that I agree with that. I think anybody can have the virus in their nasopharynx and can spread it, especially when they cough or sneeze and particles fly out. So yes, a child can bring it to their family, to their grandma, to their school, but they can bring any respiratory virus. I mean, that's part of being human.
Right.
Yeah.
So the first step was to mask, right? That was the thing that everybody was, social distancing and masking. I'm going to just jump right in on this one. Was there science to back mass masking, especially for children?
So no, the answer is no. There is no science that shows that masks work for any respiratory illness. I did a review of over 100 articles going back as far as the 40s and all the way up to the present time. I did this in the winter of 2020 into 21 because I wanted to be sure that I knew what I was talking about. And I reviewed over 100 mask articles in all different countries, different healthcare settings, community settings, school settings, home settings, different kinds of masks, whether it was cloth or just a surgical mask or an N95. And there was no evidence that, short of doing a fit-tested N95 mask or one of those space suits like the PAPRs that you wear like in an Ebola unit, there was no data to show that masks stopped the spread of a respiratory infection, especially a surgical mask or a cloth mask. And especially when people were not wearing them correctly, which most people do not wear masks correctly. So if you were in a hospital setting with a fit-tested N95 mask and you never took that off for your whole shift and you never touched your face or scratched your nose, maybe that mask provided you some protection. But that is a very small subset of humans that can do that.
Exactly.
Yes.
So what do you think was the emotional impact on our children when they go from being social beings in, these cohort environments where they're around other kids to being set at home, away from everyone, and masked everywhere they go? Everyone is wearing a mask. What implications did you see in children in that?
Well, we're still seeing it today with a large percentage of the kids. The reason COVID was so successful was because they created fear.
Wow. Wait a minute. You just said the reason COVID was so successful.
Mm-hmm.
Sounds like it was a contest.
Yeah. I've never heard anybody phrase it that way in that setting. I mean, I totally agree with you.
Mm-hmm.
So I want to, before we go into the whole mask thing, when you say COVID was successful, we're not talking about the virus.
Oh, no.
What are you talking about?
So COVID was something that allowed, I believe, the powers that be to see what kind of an effect they could have on the populace. I think that they looked at ways that we can control people. How can we gain more control over people's lives and the population? How can we get a little bit more power in what people hear or what people think? And one of the best ways to do that with humans is to make them fearful. And so COVID was just the method to do that. Yes, it was a real infection. I believe that COVID is a real infection. It's a real virus. And people did die of COVID. I'm not saying that it wasn't a real virus. But I don't think that that was the main thing that came out of the last 4 years.
Wow. Yeah.
And this is how we get a brand new podcast canceled.
Sorry.
It's true.
You can cut that part if you want to.
No way.
No, we're all in.
Yeah. So, there's a lot. Let you finish your thing on the masking and the impact on children's lives.
Okay. So what kids experienced, well, I'll just say, like at my house, I have 4 girls, and they were middle school through college, high school through college when it hit. And so they just thought it was awesome, and they got to stay home, and we got a new dog, and, you know, they did some of their homework, sort of, but it was sort of a prolonged vacation. But they had food, and they had parents that loved them, and they still got to go outside, and they still got to see their friends. We didn't enforce any of those rules. But they also had parents who watched the news with them, and we watched different stations, and we read a lot, and we discussed a lot with them, and we said, hey, don't believe everything you see or everything you hear, and really think about this. Do you need to be fearful of this? And as more and more data comes out, let's analyze that data, and let's look at it. And let's not just take what the media is telling us at face value, and let's assess it ourselves, and let's do our own research. And so my kids were not fearful of COVID, and they were not fearful of the world. But I think that there were a lot of kids and families who, I don't want to say bought into that, but really they didn't know any better. They didn't know how to research. They trusted the professionals and the doctors and the government officials, and they did what they were told. And as you watch more and more of that news cycle, more and more that fear gets ingrained, and those kids kind of just marinated in that fear. And so they were afraid to go out. They were afraid to see their friends. Even once they were allowed to go back out, many of them still had that fear. I just saw a kid in the office yesterday. He had on 2 masks. He's in high school. He wears his masks to high school. His parents also wear their masks to the office. So there is still that fear in a certain percentage of the kids and in the families. And I am worried that some of those kids will be rewired forever. And that's the kids that were old enough to be conscious of what's happening. If you take a little kid that was born during the pandemic and their parents were fearful, they grew up not knowing anything but that, and those parents have been rewired. And then some of that fear will forever be passed on to that kid in everything they touch in their life, and every interaction, and every way that they look at the world. So I worry that that is one of the biggest things that has happened to a large population of our kids.
Yeah, for sure. How would you say over the last 25 years or so, over a quarter century, how has the field of healthcare shifted or changed? And then the B part to that question is going to be, what role has government